Hi friends, hope you guys are doing great. Now, I'm here to talk about patients' rights. Did you know that patients, or when you're sick, you have rights? I'll mention a few of them here. You have a right, as a patient, you have a right to privacy. What do I mean by privacy? For instance, if I told you in an examination room, you're to be examined by a doctor, a nurse, a midwife, you are supposed to have the privacy. Like the door should be closed, the windows should be closed, or you should have a screen around you from where you're being examined, just for your privacy. It's not that everyone should see what is wrong with you. Then the other thing, you have a right to access to information. A right to information. You are supposed to be given information about your condition, about any other condition you would wish to know. So that's your right. Then you also have a right to access to all services provided in a particular facility. Different facilities have different settings. They have laboratory where they do blood for HIV, for malaria, syphilis, and all those things. Like anything they can test, CBC, renal functioning test, everything. Like then there is also the immunization area, the YCC, the Young Children's Clinic. There is the OPD where they see the outpatients. Then there is the pharmacy. Like they have small departments in those hospitals or facilities where they provide different services. So you have a right to access all services provided in a particular facility. Then, much as you have some rights, then you also have some responsibilities as a patient. If I go to the responsibilities, you also have a right to information. Then you also have a right to informed consent. Like, for instance, if they are going to, which example should I give? For instance, if they are going to operate you for any reason, they have to like explain to you the reasons as to why you need the operation and stuff. After you understanding each and everything they are going to do on you, that's when you're going to go ahead and sign the papers that you've accepted the operation. Like an informed consent, they teach you, you get the information, then you decide. So you sign if at all you've accepted the operation. Then much as you have the right, but you also have some responsibilities as a patient, and one of them is to give or provide accurate information about yourself. Like you come to the hospital, you give us your biodata, everything, next of kin contacts, then you go ahead and tell the doctor or the nurse or the midwife how you are really feeling without reservation. For instance, you say, Msao, I have diarrhea, I have ABCD, I have ABCD, I have ABCD. Like you exhaust all your complaints that have brought you to the hospital, because this is going to guide us to know where to begin from, what tests to be done. Like it's going to make the assessment very, very, very easy. So like it will as well guide the diagnosis. It's going to help us make a right diagnosis because you've exhausted how you really feel. Then the other thing, you also have a responsibility of following all instructions as you're told. For instance, they have given you drugs, they have told you, this drug, you shouldn't take it with milk. You're going to make sure that you follow that instruction. There is a reason. Could be milk slows down its effectiveness, could be, Then they are going to tell you, not take this drug with maybe milk. Could be the milk is going to help us like quicken its action, like it's going to be absorbed very fast and it will work very fast, Then if you're told maybe to take drugs maybe before food or after food, there is a reason for that. So you're going to follow those instructions. It's your responsibility to follow the instructions so that you can get better, you can feel better, so that the medicines can work for you well, Then the other responsibility you have is to as well respect other patients and also the health workers. You need to respect each other and also respect other people's property. Some patients can steal things, so you need to. Happy Monday.